And our event will answers to two questions. The first one is, what is the impact of air pollution on our health? And the second one, how can we mitigate the impacts of air pollution through EU regulation? To this end, the event of today will be in two parts. For the first one, researcher from Helmholtz Munich and Delft will explain why air pollution is a major health issue. And for the second part, panelists will debate on whether we can solve this problem. So the aim of this event is to present a comprehensive overview of this topic, and with the permission of the researchers, we will share with the audience the presentation after the event. The presentation will be short in order to have more time for the questions. Indeed, we are also here together to allow as many questions as possible, and please use the chat function under Zoom. Even during the presentation, do not hesitate to post your questions in the question box. My colleagues and I will constantly monitor them, and I will make sure to bring them to the discussion. We have a live tweet for the event on our Twitter account at EPHA_EU, so at EPHA_EU, and you can also share your comments with the hashtag Clean Air Healthy Cities and Medics for Clean Air. And after these housekeeping rules, let me introduce EPHA and our work. But first, I would like to thank you all for joining us to this event on air pollution and health, improving air quality and tackling epidemics. And that's really a pleasure to have you here. What is EPHA? EPHA is the Europe's largest public health NGO advocating for better public health in Europe. And our members are pan-European and national non-profit organizations. We work on different public health related topics, such as access to affordable medicines, health inequalities, non-communicable diseases prevention, and air pollution is one of the highest causes of death among all health risks. So we must raise awareness on this major public health issue. Air pollution is estimated to have contributed to 6.6 million deaths worldwide in 2019. And air pollution mostly increased morbidity and mortality from non-communicable cardiovascular and respiratory diseases. Hundreds of millions of healthy years of life are lost due to air pollution, and according to the European Environment Agency's work, in the EU in 2019, more than 300,000 premature deaths were attributed to chronic exposure to PM2.5, also known as fine particulate matter with a diameter of less than 2.5 micrometers. As a public health organization, we focus on root causes, and air pollution is a key example of an environmental risk factors where individual level changes are either unavailable or inefficient. It makes a coordinated action essential. That's why EPHA applies the public health approach to air pollution, and more specifically to transport and heating. We have developed evidence-based policy to better understand the interlinkage between health and transport. A year ago, we published a study that calculates the health cost of air pollution in 432 European cities, and we try to monetize this health cost. And for instance, air pollution cost per person around 1,400 euros in Brussels. And to improve air quality, it is crucial to hear from experts. That's why EPHA is supporting a new campaign named Medics for Clean Air to help healthcare professionals to speak out about the public health emergency caused by air pollution in Europe. And Medics for Clean Air is a European coalition of doctors, nurses, researchers, medical students, and other healthcare professionals. They have signed a manifesto for urgent and sustainable actions to tackle air pollution and to protect their patients and our environment. And the whole campaign is online on a dedicated website on medics4cleaner.eu. And if you are a healthcare professional, you can sign our manifesto. But what does the Medics for Cleaner want? They demand decision makers to take notes of the latest scientific evidence on the health damage of air pollution as a basis of any future air quality policy. And the World Health Organization provides the most well-known air quality framework named Global Air Quality Guidelines. And the WHO launched in its much anticipated new air quality guidelines on the 22nd of September 2021. And it's crucial for us because the WHO air quality guidelines identify the levels of air quality necessary to protect public health worldwide. They are based on extensive scientific evidence, and they set ambitious goals for air quality to protect public health. So the WHO air quality guidelines are not legally binding. They are a set of recommendations, but they may serve as a reference for setting legislation and policy to reduce levels of air pollutants and therefore to protect human health. We can use them right now. The European Union Clean Air Policy works, but it's not enough. Air quality remains a major health and environmental concern, and the current EU standards are less ambitious than scientific advice. A top priority for health is that the EU fully aligns with the air quality standards, with the new WHO guidelines by 2030 in the upcoming legislative revision of the ambient air quality directives. The faster we will implement WHO air quality guidelines, the healthier air we will breathe. With those ideas in mind, I'm looking forward to learning more today, and I'm pleased to introduce our panelists. We have with us Professor Dr. Annette Peters from the Helmholtz Munich Institute of Epidemiology. You are the co-author of the recent report on impact of environmental factors on viruses and virus infections. And good morning, Annette. Dan Huyn is a researcher at Delft. You authored Air Pollution and COVID-19 Social Cost of Estimate of Air Pollution Related COVID-19 Control Measures. Good morning, Dan. Dr. Nan Fanti, pediatric pneumologist and allergist. Good morning, Nan. And Vincent Franco, you are policy officer for Clean Air at the European Commission, DGN Unit C3. Good morning, Vincent. And we have also Thomas Limes from is policy advisor for mobility at your city. And good morning, Thomas. And also Ugo Tadei, director of nature and health at Client Earth. Good morning, Ugo. We'll start with a presentation from Professor Dr. Annette Peters. You are director of the Institute of Epidemiology at Helmholtz Munich in Germany, and full professor and chair of epidemiology at the Institute for Medical Information Science, Biometry and Epidemiology at the medical faculty at the Ludwig Maximilians University of Munich. So it's a pleasure to give the floor to Professor Dr. Annette Peters. Annette, the floor is yours. Thank you.
Yeah, so thank you very much for the invitation and the kind introduction. It's my pleasure to talk about air pollution and virus infections. And I would like to draw the attention to a study before the pandemic, which looked at hospital admissions in the Medicare a database, daily hospital admissions, and identified a number of known and novel causes. And one of the striking features is that among those are a lot of infectious diseases, pneumonia, septicemia, and urinary tract infections and others. And the authors estimated that more than 2,000 hospital admissions yearly, 12,000 hospital days, and 28 million euros care were expended due to these multiple causes. And so the hypothesis to linking air pollution to COVID-19 are multifold. Air pollution may impair our immune defenses and therefore may make an infection more likely. And also it may act indirectly via chronic diseases. And in addition, it has been discussed that also the particles themselves could help in the viruses to enter into our lungs. And so we conducted a literature review, which was considered publications until the 1st of October 20, and we screened more than 1,290 studies and reviewed 52 articles in depth. And it's important to note that we not only looked at COVID-19, but also other virus indices. While doing so, this actually raises a number of concerns from an epidemiological perspective, because this was a very dynamic situation and reporting was incomplete and heterogeneous over space and time. Also, exposure assessment was difficult because exposures were changing, and also there was probably substantial misclassification. And furthermore, the early studies at which we looked may suffer severely from the lack of confounding variables because they had ecological designs, and also maybe there was lacking information on certain occupations who were at increased risk. And so we have the abatement policies overlaying these studies, which may modify the confound or modify the associations. That said, when we looked at the evidence for influenza, we saw a small relative risk increase, which was statistically significant, and is in the sign for time series analyses, or in the magnitude as we would expect it. Also, the very short and potentially confounded time series showed an increased risk for NO2. The long-term studies, which have the potential of ecological fallacy, when we combined them, we saw surprising clear associations, both for PM2.5 and NO2 with respect to mortality and incidence. But as I said, this may be, there may be a high degree of bias, and these estimates may be overestimated. Luckily, there is now emerging evidence from cohort studies. So the way we actually would like to look at this, and I would like to draw the attention to a publication from November last year, which looked at a cohort of more than 9,000 people, in which also serology was performed. And this cohort could show two things, namely there's an increased risk for severe disease in this cohort, which is of comparable magnitude as previous studies, and that in particularly those who had who were seropositive, they had higher antibody titers, corroborating or supporting the evidence that there is indeed a worsening of disease in those who are affected. And the good thing about this study is that they had both area-based and individual confounders. Of course, the dynamic and the underlying test strategies and so forth, in part, may still be at play here. And it's also important to note that the situation is complicated because the air pollution was changing as a consequence of the pandemic. And this is the satellite pictures we all know from China. And if you then apply the known knowledge on chronic disease impacts, we would expect a substantial burden reduction. So to summarize, I would say there is emerging evidence that air pollution links to infectious diseases, something we have overlooked maybe before. And the pandemic situation is complex, and prospective studies, cohort studies, are needed to understand the impacts fully. So it's still kind of early days. However, action to reduce air pollution is needed to preserve health and contribute to climate change mitigation, building on the evidence both from chronic disease epidemiology as well as maybe additional emerging evidence now. Thank you very much.
Thank you very much. Yeah, indeed, it was very interesting and Thank you very much for your presentation. You suggested policy responses are your suggested policy responses are very interesting, and for the debate because we can act, and the European is able to regulate these harmful pollutants. In 2020, our attention was drawn to the global epidemic, and some studies suggested that exposure to air pollution worsens the severity of COVID-19 on people's health, and lockdowns in many cities demonstrate that carbon dioxide emissions, air pollution, and noise levels can be reduced, while urban space for walking and cycling could increase dramatically, improving both our environment and our health. And then you are a researcher consultant with Delft economics department. You estimated the cost of COVID-19 control measures, so lockdowns, school closure, mask mandates, etc., that were necessitated by air pollution. What can you tell us about this topic? The floor is yours, Dan. Thank you.
I will. You are sharing your screen for me. Let's see. Great. Yeah. So. I work at CE Delft. If you could please go to the next slide. We are an independent research and consultancy firm. We work for governments, industries, and NGOs, mainly on environmental topics. And one of the important topics that we study is air pollution. So if you could please continue to the next one. In this study, we basically build on the study of the Helmholtz Institute, and we say, if it is indeed true that air pollution increases virus transmissibility, then more or stricter control measures were necessary in Europe to curb the spread of COVID-19. And of course, these additional or stricter measures induced all kinds of social costs, so emotional, psychological costs, also economic costs because businesses had to close, and also health costs. And a very natural question to ask then is, how large were these costs actually? In this study, we present a case study, so we only look at the Netherlands. And in the end, I will say a bit about how these results for the Netherlands translate to other European countries. And next slide, please. So, as Annette told us, it is so far still uncertain how large the effect is, or how large the relationship is between air pollution and virus transmissibility and the severity of disease. In this study, we looked at different academic papers estimating the relationship between levels of air pollution and the effective reproduction number of the virus. So after 2 years of COVID, I think you all know by now what the reproduction number is. In that study, we took a conservative estimate based on 4 different econometric analysis. We picked the smallest effect size of those 4, and this translates in the Dutch context to a reduction of the reproduction number from 2.3 to 2.05 at the very start of the epidemic in March 2020. So we can go to the next slide. So we have an assumption about the effect size, but we need to translate this to the social costs. And the social costs of the control measures that were necessitated by air pollution are pretty hard to estimate. We have all kinds of emotional burdens, which are not very easy to monetize. And it's also not particularly clear which measures to attribute to air pollution. You can make different combinations, and these yield different outcomes. So we therefore took a slightly different approach based on the so-called Pigouvian assumption. And this assumption says that governments only take additional control measures if the benefits of those control measures exceed the costs. So if we make this particular assumption, you can say that the benefits form an upper bound of the social costs. And the benefits of the control measures here are exactly the same as the prevented costs of an uncontrolled pandemic. So using this assumption, we can reroute the main research question and look at the prevented cost instead of the cost of the control measures themselves. So we needed to estimate the health outcomes in case of uncontrolled virus spread, and we employed a quite sophisticated infection model for this. I don't have time to fully explain the model. Important to know here is that we ran this infection model 2 times, one time with regular levels of air pollution, and then one time with slightly different inputs where we adjusted the parameters based on a situation without air pollution in the Netherlands. So this infection model yields a bunch of different outcomes. For instance, the number of hospitalizations, the number of ICU admissions, ambulance rides, loss of work days, but also the number of people that pass away due to COVID in a scenario of uncontrolled spread. And we subsequently monetized all these outcomes using a valuation model. And here you can see some of the most important assumptions underlying this valuation model. Perhaps the biggest number here, or the most important outcome of the infection model, is the number of deaths. We value a statistical life year at 75,000 euros a year, based on international literature. So what does running this infection model, given the different assumptions based on a scenario with and without air pollution, actually imply? You can see on this slide that the number of hospitalizations, the number of deaths, the number of ICU admissions all decline if we assume that the reproduction number is lower. So this lower reproduction number would stem from decreased air pollution. And we can subsequently monetize these differences in epidemic outcomes. And on the next slide, we can show that the social costs, that they run up to about $11 billion without air pollution. Now, I have to add here that this is an upper bound, because we have to imply this Pigouvian assumption. We can't directly say what the social costs are, but we can only compute an upper bound. And in the Dutch context, this upper bound we found was $11 billion. And this is very substantial. It equals about 1.5% of Dutch GDP. And an important observation here is that air pollution levels in the Netherlands are quite low compared to countries such as Italy or Eastern European countries. So countries with higher levels of air pollution may see even larger relative costs than in the Netherlands. What does this imply for European policy? The relationship between air pollution and virus transmissibility is still uncertain, so we need more research to establish more certain effect sizes. Nevertheless, we can say that the relationship between air pollution and virus transmission forms an additional argument for ambitious air quality policy. So we already know that air quality policy is necessary to prevent all kinds of health outcomes, but this forms an additional argument. So thank you very much for this time to present a short presentation of our study.
Thanks a lot, Dan. Your presentation was very interesting, and yes, indeed, we need more studies in these topics, on these topics. And EPHA will publish 2 new studies in the coming month: one on clean heating and one on clean transport at the end of March and in April of this year. So it will be a pleasure to have you all attending the 2 launch events. We'll send you more information in the coming weeks. Your study, Dan, your study is now available on the EPHA's website and on the Delft one. So if you want, you can read it right now. It's the same for the Helmholtz Munich study. It's available online. We'll share with you the links in the description. So Dr. Nyan Fanti, you are a pediatrician specialized in pneumology and allergology. you're implicated in research in the field of allergy, environment, and pollution, and you are a member of the National Conseil de l'Air of the ANCES, former head of allergology unit in the Pasteur Institute in Paris. And could you please explain the health effects of air pollution, and especially on children? Thank you.
Yes, so it has been well proven that the air pollution and the fine and ultrafine particles have an effect on the airways on the children, and especially on the atopic children who has asthma, allergic rhinitis, or hyperreactivity of the airways. So they do have more symptoms during and after the spikes and the high level of pollution, of air pollution. So we have a lot of data. This is really a concern for their health.
Okay, thank you very much, Dr. Nan. And at EPHA, we usually talk about particulate matters such as PM2.5 or PM10, but ultrafine particles, PM0.1, pose, like you said, a major health risk, and we underestimate their effects on health because of the lack of data. And yeah, children are more vulnerable to air pollution, but it can even we have also the same problem with vulnerable groups such as old people, patients with chronic conditions. Tackling air pollution is really a matter of life and death. And now we can also introduce Vincente Franco. You work at the Clean Air and Urban Policy Unit of the Directorate C, in charge of zero pollution in the European Commission's Directorate General for the Environment, where you focus on the revision of the ambient air quality directives and on the zero pollution actions plan. Vicente?
Right. Yeah. Thanks. Thank you. It's really nice to be here. I was taking notes because it's really interesting. Both the studies that you're presenting today, they have high level of quality, and I was thinking about reminiscing about the early days of the pandemic when studies kept coming in almost on a daily basis, to the point that we had to establish a sort of war room where we had to try to kind of do a peer review inside of the house of the commission to see if there was any substance to these claims that we were seeing in these papers. Some of them at the time were undergoing very light peer review processes, and maybe that's the reason why there was such an inflation of studies. But once we started weeding out, so to speak, the less robust studies, I think there was a picture starting to emerge about, yeah, indeed, there being a connection between the exposure to air pollution, especially long-term exposure, and especially PM2.5 more than NO2, although there's evidence for both pollutants, and an exacerbation of COVID-19. And intuitively, I think this made sense to us. It's air pollution is a chronic exposure to air pollution is making the population weaker, less resilient to infection. And when a pandemic comes, it makes sense intuitively that you would see in populations that are less resilient, you would see worse health outcomes. So that to us made sense from the beginning. And now that the dust has started to settle, and that the more long-term studies are starting to emerge, we're taking that on board, and we fully understand now, and it's starting to become an established fact, with a certain margin of uncertainty around the quantification of the precise effects. But for sure, it's clear now that the air pollution is playing a role. The second part that we were looking at it's the transmission, and that's something, I don't mean to preempt the debate, but I was a bit surprised when Dan was showing an increase in transmissibility and putting the focus there. because to date we don't really see a clear mechanism to justify this increase of transmissibility, and I wonder if Dan sees that differently, or if this increase in R is just the consequence of modeling an increase in the number of cases, and that has a consequence in an apparent R where maybe there is not a real transmission. So the question of whether the virus is traveling on PM and it's causing a greater number of infections, to us it's still open, and there doesn't seem to be a high degree of evidence there. And the third one is the third angle that we were looking at is how did the lockdowns affect exposure to air pollution, and how it was an interesting natural experiment, having traffic practically shut down for a month in many cities in Europe. So that was also very interesting for us, not from the epidemiological perspective, but from the pure air quality monitoring perspective. In short, it was a very interesting event, the COVID-19, and it was proof to us that good air quality matters for public health, that it translates into very real and very expensive to impacts, and of course it gives us a lot of confidence and moral support in the task that we're undertaking at the moment, which is the review of the EU rules on air quality, which we can discuss later. I think I took up too much of my time for my intervention with this. But this is, of course, all of this evidence is really helping us, and especially when it is as well supported by evidence and as measured and well articulated as these two studies. So kudos to you for producing these studies, and looking forward to the discussion. Thanks.
Thank you, Vincent. Yes, indeed, it's a very good question, and I'm sure Dan will be able to answer your question during the debate. And thank you very much also for your work on the revision, and we hope that the proposal will be ambitious, but we will see during the debate. Our attention then turned to cities after our study on the health cost of air pollution in 432 European cities, and we tried to find a solution, because more than 80% of people living in urban areas have a very high level of exposure to air pollutants that exceed the World Health Organization's limits. So low income and other disadvantaged people are the most impacted, and that's why it's important to have with us a representative of your cities. Thomas, you are a policy advisor in charge of mobility and air quality at your cities, where you advise a network of more than 200 cities in Europe on EU policies on mobility and air quality, and you are also involved in different projects on clean transport. And I have a question for you. Yes, Thomas, why is air pollution a key concern, especially for major cities? Thank you.
Thank you, Matteo, for the introduction. So yes, indeed, just for those that are not familiar with Eurocities, we represent more than 200 largest European cities in Europe. So of course, air quality is high on the agenda of most European cities. Is a concern for many of the local authorities to preserve the health of their citizens. But it's also a matter of livability in cities. We see that you mentioned that the fact that 80% of the EU population live in urban areas these days. This number is likely to increase in the years to come. So it's important, if we want cities to remain attractive also for citizens, if citizens do not want to be concerned by their health, I mean, we're living in a current era of global pandemic, there might be others to come. And the studies that were presented today by our colleagues show that, the atmosphere, the air quality in cities may have an impact on their health even more during this state of global pandemic. So it's important for local authorities to make sure that citizens feel safe and can not fear for their health when living in urban areas. Of course, what can cities do to improve air quality in urban areas? There are many leverage that cities use. The first one I could mention is the monitoring, of course, of air quality in cities through monitoring stations, through other means, which is the first step, of course, to take measures to reduce air pollution. Then the second step is when, of course, air pollution level are critical in cities. Cities can take short-term or long-term measures. Like short-term can be, for instance, to make public transport free in the city, to make sure to nudge citizens and ensure that they use more public transport. And of course, there are long-term measures that are often part of local air quality plans to reduce air pollution exposure. So there are, and I could name a few. For instance, there are many schemes that are being implemented in different cities in Europe to ensure that citizens replace their heating system. We often talk about low emission zones that are being more and more common now in European cities, and that are already showing visible results. Could name, for instance, what's happening in London. London has recently expanded its ultra low emission zone, which covers the city center of London, and you could see, for instance, in some cases, a reduction of 50% of certain air pollutants, so it means that when cities take measure on air pollution, there are visible results. That's a bit what the overview of what cities can do. Of course, I could name even more measures, but I will stop now.
Thank you very much, Thomas. Yes, at EPHA, we released a study in March 2021 on air pollution and transport policies at city level. And yeah, we work on this topic. It's very important, very interesting. The report analyzes 28 types of urban policy currently running in different cities around Europe, from zero emission public buses to sharing e-scooters, for instance. And we find that banning polluting vehicles could cut harmful particulate matters in cities of over 1 million residents by up to 23%. So that we have solution, but now we have to implement, and we need the help of mayors and city leaders. They can play a key role in tackling social cost of city level air pollution. And following the study, EPHA has formulated policy recommendation to help them implement target policies interventions to improve people's health and the environment. So we'll share also this link with you in the description, so you can read it there. So thank you very much. And now, yes, we can hear you, Ugo. Ugo, today you are a lawyer, Director of Nature and Health at Client Earth, and you oversee the strategy and management of Client Earth's nature and health portfolio, including programs on clean air, forest, wildlife, plastics, and chemicals. And you also lead Client Earth Clean Air program, and that's why you are here today. And the legal team, who is bringing a wide range of litigation cases across Europe to protect the right to clean air. That's very important also for us, the right to clean air. And you are involved in litigation in more than 11 EU member states, and including a series of successful clean air cases in the UK, and the legal actions in Germany, resulting in court orders to restrict access of diesel vehicles in cities. And Ugo, the floor is yours. Thank you.
Thanks a lot, Matteo. And thanks all for this very interesting discussion. I think this is really what we need. We need science to be in discussion with decision makers, with policy makers, with civil society to identify the problems and find the good solutions. And in my view is that today we are living in very unique times. We are facing some very big challenges and very big crises. We're facing an unprecedented climate crisis that requires ambition, action. We're facing a huge crisis for biodiversity, also for human health from pollution, as you said. And on top of all this, COVID, a global pandemic, happened to add to the problems. But I think that the good news is that we have now a very good opportunity to change the system and to put our society on the right track. There is a unique combination of factors that give me hope that we can really change our societies and tackle all these problems together. If we look only in Europe, we have the unique ambition of the Commission on the EU Green Deal, so a bunch of policies that can really have an impact on different topics. We have now also a very big and ambitious recovery plan that will provide help to build back better our societies. And we have seen how, for instance, tackling transport can really make our cities much better places to live and enjoy without traffic, without noise, without pollution. And we also have a unique opportunity in relation to air pollution, because the Commission is now preparing a proposal for revising European air quality laws and ensure better protection of our health. And to be very frank and direct, I think that this is a once-in-a-generation opportunity. Unfortunately, European laws on air quality have been lagging behind science already for many years. The current directive was already inadequate to protect human health in line of the old WHO recommendation. The situation and the gap has only grown since in September 2021. The WHO revised their global recommendation for air quality. We have now a situation where levels for PM2.5 in Europe in law are 5 times weaker than the WHO recommendations, or for nitrogen dioxide, the gap is 4 times bigger. So we have a huge gap between our legal framework and our policies and what science tells us that we need to do. So I think that it will be important that when looking into this new directive, we need Europe to be a leader in protecting people and protecting health, and being a global leader, which at the moment is not the case for air quality laws, where, for instance, the US or other major economies in the world has much stronger legal framework to protect people from health. So I think that my key takeaways from today is that we have very big challenges ahead, but we have a unique opportunity to make a real change, to change our cities, our societies, to be sure that we protect human health and people in the right way.
Hugo, you are right. Thank you. Science is central, and we must take note of the latest scientific evidence on the health damage of air pollution as a basis of any future air quality policy. And I agree there is a political momentum in Europe to address these issues. And we will talk more about the political solutions in the debate. So we can open the discussion time now. We have received questions from the audience. You can still send us your question on the chat box, and the other panelists can react to any question. So now we can start. Let's start with a question from, we have a question here. To Annette, what are the main challenges facing a researcher on air pollution? And what are the difficulties facing researchers investigating air pollution and airborne diseases like COVID-19? Thank you.
Yeah, so indeed, I think the major challenge ahead of us is really the complex changes we are experiencing during the pandemic. So on the one hand side, we had this reduction in air pollution and noise. So we have changes. At the same time, our living conditions changed substantially. We had the increased risk because the population as such was unprotected against these infections, or there was no immune response mounted yet. And now we are in the phase where we see slowly this has been, we are adapting. And the other issue we are having from a overarching perspective is that infectious disease science and chronic disease science was really separate. And for a long time, a lot of us were chronic disease researchers in Europe. And if we were global, people were working on infectious disease. And now we need to bring this together and understand the interplay. And for SARS-CoV-2, but also for other viruses, and then kind of piece the environment in there. And I think this will require rethinking of our methodology. On the one hand, we want to be quick and data shall be available. At the other hand, we want to be thorough and really come up with the right answers. So I think it's really the cohort studies and the thinking of how we are now in this new situation are going to address these questions with infection, with long COVID, with major changes in healthcare provision, and how environmental exposures are piecing in. And then if we can, on the one hand, figure that out, and on the other hand, really show that reductions, even only transient reductions, have had benefits. Not only people saying, "Oh, wow, this is now really great. It's loud. It's not so loud. It doesn't. I can breathe better." The asthmatics, they, for example, had a big benefit during the lockdown periods, and so forth. So that we really get the cohort data together, that we think of the data we need to collect for the future to answer all these questions and to make sound recommendations. I think this is a challenge to us. And I think this is a good challenge because at the same time, we have a lot of evidence already on the health impact, and there is sufficient evidence to act on the commission level as well as on the global level, so that when we design the future research, we can have that in mind, that potentially we can also show the benefits of policies which are hopefully coming very soon.
Thank you very much, Annette. It's very interesting, and I have a question for Dan. No, sorry, Vincent. Vincent has a question for Dan. So can you maybe then answer the question that Vincent asked you during his short introduction?
Yes, of course. Thank you, Vicente. I think that's a very good and relevant question. I think it consisted of two parts. The first part of your question was, by what mechanisms would air pollution increase the spread of COVID, right? So there are basically two ways this could happen. The first you already mentioned, which is that the virus particles actually attach to the fine particulate matter and thereby enter the lungs. There's also a second mechanism that explains increased transmissibility, and that is that air pollution can induce short-term harm to the lung tissue and the immune system, thereby making it easier for virus particles to actually cause an infection. So those are the two mechanisms by which air pollution could increase the transmissibility. And I fully agree with you that there's fewer evidence suggesting that this is really the case, or the evidence is weaker than for the virus effect on disease severity. Nevertheless, we focused on the transmissibility because we think, although it is more uncertain, its relevance might actually be larger. If you look at two different types of viruses, one which is very transmissible and only mildly severe, and another virus which is not very transmissible but a bit more severe, the first virus could be far more dangerous simply because it infects far more people. So that's why we focused on the transmissibility aspect, and the way we estimated the effect size. So what does air pollution do to the effective reproduction number is a bit different from the studies that Annette used for her meta-analysis, I think, because what we looked at are econometric analysis that try to estimate the relationship between levels of air pollution and the effective reproduction number. So that's slightly different from studies estimating the relationship between air pollution and the number of cases. If you look at the reproduction number, it's a measure of how fast case numbers increase. And basically what these studies do is they look at periods in which air pollution is higher than normal and look whether the reproduction number is also higher during such moments. Does that answer your question?
Yes, thank you very much. That's much appreciated, and it's very, very clear. No, it confirms what I thought was your thinking, and yeah, we're on the same page. Thanks very much for that.
Great, thank you very much, Dan. And yeah, I have a question for Dr. Nyan. Has the COVID-19 pandemic affected the health and well-being of children with underlying pulmonary issues? And if so, how?
Yes, the initial concerns about children with asthma affected by COVID has not been realized, in fact. Well, it wasn't clear if it was because of the reduction of other causes of asthma exacerbations, like improved air quality or reduce other viral infections as well, or not. So I would say that, unfortunately, COVID would be the wrong example of virus that would have proved the collaboration between the fine particle pollution and the viral infection in people with a health condition like asthma, which is the most hyperreactive situation or condition to pollution. So, but paradoxically, we could say that asthma may be protective because, sorry, I will go into details, but the receptor, the famous ACE2 receptor required by the COVID virus recognition and infection. So this receptor may be underexpressed in the lungs of the age-weak children. So COVID would have entered, if COVID would have entered in another pathway, it would have been catastrophic. As maybe the flu model would have been a greater model to prove that this collaboration between the pollution and the infection. Well, whatever, for the future, we have to prepare to collect these data with these, and as Annette says, prepare the prospective cohorts and enhance. We have to enhance the measures that we don't have much, particularly in fine particles. So, for example, in Paris, we don't have much data, and I think this is a great field to analyze the influence of these particles in the lungs, in the human system, to explain that how this pollution can enhance the viral infection. Thank you again for all this very good work.
Thank you very much. It's indeed very interesting. Your explanation is very interesting. Thank you very much. And now we have a question from Thomas. To Thomas, yes, sorry. What cities can do to improve air quality in general? And
well, I mentioned a couple of measures in my introduction, but of course, well, cities can do a lot, of course, but as someone pointed in the chat, pollution knows no border, meaning that your neighbor could emit could have an impact on the level of air pollution in cities. So what we need and what we would complement the measures I previously exposed is to have a strong EU framework on air quality. Meaning, and as Ugo mentioned, we have a political momentum, and at the EU level, since the European Commission is about to update its rule on air quality, and following the new WHO guidelines. So what we need to have in this EU framework, of course, is to have it based, of course, based on scientific evidence, meaning that we have to consider what the WHO recommends. We have to tackle emission at the source, because of course a city doesn't have any influence on emission standards, for instance, for cars. Transport being one of the main sources of air pollution in cities, we have to make sure that at the EU level, the next generation, for instance, of vehicles is as ambitious as possible. And just a note on this, we were expecting actually the Commission to publish these new standards a couple of months ago, and we recently heard that there are some delays, which will have an impact on air quality in city, because of course the later you publish the new proposal, the later it will come into force, and this will be months that will be lost, and maybe years that will be lost in the preservation of citizens' health. So what we need is to have this strong EU framework, overarching framework, as ambitious as possible, making sure it addresses the loopholes that are currently in the current framework, and to have this consistency also between all the EU legislations that have an impact on air quality. This Fit for 50 package on climate that is supposed to be this comprehensive push from the EU to achieve its this climate objective. I hope we'll have the same for air quality in Europe, meaning that all the pieces of the puzzle would fit together, and that we can and that this would complement cities' efforts.
Thank you very much, Thomas. And now you have some questions for Vicente. That is the very first one is, when will the Commission publish its proposal for the revision of the ambient air quality directives? And also a question from Ireland on what are the main challenges that the European Commission faces when trying to implement new air quality policies? Thank you.
Thank you. No, very good question. The first one is rather easy. So we're now we're at the impact assessment stage, and we expect to have it finalized by the second half of this year, and then adoption will. So by the end of first half, we have the impact assessment finalized, and by the second half of this year, we expect to have adoption by the college, which means that 2023 will be the co-decision process, which can take a while, but the final output of the Commission is going to be ready in a matter of months. And I have to say that it's been a long way in the making. It goes back to a revision of our legislation that we undertook in 2018 and 19. At the end of 19, there was this the European Green Deal communication, where we announced that we would align more closely with the latest scientific evidence, meaning the standards that were published in September. So all the pieces are coming together, and we expect to have a very good proposal still this year. The challenge that we are facing, well, there's several. First and foremost, it's that the WHO standards are very ambitious, I must say. They are practically, for most pollutants, they mirror background natural concentrations. So it's going to take a lot of effort to reach those concentration values across the board. But other than that, the challenge is to update the framework. It's every time there's, Hugo said that this is a once in a lifetime opportunity, and he's absolutely right. This kind of revision does not happen every year. I can tell you that it's a special time for air quality legislation. Every time that there is a revision of the framework means that everything is open, everything is on the table. And for this particular revision, we said, I know that the headline is the closer alignment to the new WHO standards, but there's more than meets the eye. There's actually a review of the legislative framework, things like sanctions and penalties, mechanisms to keep the limits up to date as the evidence comes, not just every 10 years. Those are things that are under consideration. And there's also a lot of work going on improving how monitoring is done, how air quality modeling is used, and how air quality plans need to be prepared by the member states. Because one of the elements of feedback that we got from stakeholders, including member states, is that perhaps these aspects of monitoring, modeling, and air quality plans were under-specified in the directive, and they would welcome more a higher level of harmonization, of specification of how things should be done to make sure that everyone is monitoring, doing air quality modeling and preparing their plans under the same framework and the same sort of boundary conditions. So yeah, I spoke a lot, but the bottom line is that the challenges are many, and that the revision that we are undertaking is a far-reaching one that looks not just at the nominal limits, but at the whole framework.
Thank you very much. It's very interesting. Thank you very much. I have a question also for Hugo. So that's a very similar one. What are the main challenges that the European civil society faces when trying to implement these new air quality policies, and what can we do as civil society to have the most ambitious proposal from the European Commission, to help the European Commission to have the most ambitious proposal? Thank you.
Yeah, thanks, Matteo. And yeah, I mean, the challenges are big, and as Vicente said, we need ambition. We need very strong policies to put us on the right track to tackle this human health crisis caused by air pollution, because the figures are quite shocking. We don't need COVID. I mean, we're talking about more than 300,000 premature deaths every year. This needs a very strong answer from policymakers and from civil society. And I think that I would like to stress a couple of points. I agree with Vicente. Achieving the new WHO recommendation would not be easy if no additional policies and efforts are put in place. But our vision as civil society is that legislation needs to drive change. So we need the directive to set ambitious targets, and then these solutions will follow. We know this from time and time again. Whenever there are discussions about new rules, the economic sectors these say this is not feasible, it's impossible. Then you set the bar, and then the solutions come. And it would be a mistake to just settle for what is seen to be easily feasible in Europe. And we're now engaging in the impact assessment on the revision of the directive, and the initial analysis that the Commission itself has done in the Clean Air Outlook, or the initial data shared, show that already by 2030, the baseline scenario will be that 90% of Europe will be below the old WHO recommendation. So it will be 90% of the population and areas in Europe will already be below 10 micrograms for PM2.5. If the new air quality directive is going to make a change for people and human health, we need something more than just a target that will mirror what will happen. But then, yeah, as Vicente said, there is much more than just deciding what the new targets would be. We need a legal framework that will make sure that actually what is said in legislation will translate in real change, in real improvement for people. Unfortunately, we're now more than 10 years after the entry into force of the previous directive, and there are still widespread exceedances of the legal limits. Even if they are rather weak compared to what science tells us, there are still a lot of exceedances all across Europe, with I think more than 16 member states still exceeding the PM10 limit values, and more than 18 member states exceeding the nitrogen dioxide limit values. So we need strong legal framework. We need provisions on penalties when member states and authorities fail to take the policies. And we need a good monitoring network. There is another great opportunity is to have a monitoring network that, for instance, will improve data that we have on ultrafine particles. We have emerging evidence that ultrafine particles are a health concern, but we don't have data about concentration to have high quality studies on the impacts of ultrafine particles. So this is another big opportunity for the new revision of the directive to help this dialogue between policy, science, finding what the problems are and identifying the solutions.
Thank you very much. And I will quote a comment from very interesting, that limits, targets are the objectives, but source-based policy is the instrument. So I really like this comment. Thank you very much. And now I have a question. It's more general, and I don't know if someone of you has an answer, but yeah. Is there a study conducted among marginalized groups of population, people living in poverty, people living in informal and poor settlements, for instance, Roma minority? And if you have, could you share, you have a study on this topic? I don't know, maybe Dr. Annette or even Dr. Nan or Nyan or Dan, or even from the European Commission, maybe you have access to this kind of studies.
So I think in the cohort setting, these marginalized populations are really difficult and most of the time are not studied. However, with the ongoing COVID-19 research, I think there are efforts to include these groups more from the medical side of things. And indeed, this is a missing link in our assessments. Yeah. So I think it's good to highlight that there is the need to, in general, do more research in the marginalized populations.
Okay, do we have any other comments here from the panelists? I have another question, and I think this one is for Dr. Nyan. In your opinion, what is the role of the health sector and the healthcare professionals in tackling air pollution and health issues?
Well, I think one of the major thing to do is information, because the professionals and in healthcare, we have to inform them, and by this way they will inform the population and the patients, because it's not really accepted that air pollution have an action or an influence on your chronic disease. Now we have data to say that it even have an influence on all the neurological, cardiological disease. And when you say to a patient that for your vascular and neurological accident there is an impact of the pollution, it's not really known or accepted. So all the physicians, all the researchers were working with the in the field of inflammation or immunology, they have to have got this information that air pollution has this influence, because the particles, I explain it again, they go through the tissues and they enhance the inflammation wherever it is, and whatever the disease is. So we have to spread this information that the air pollution is increasing every disease was inflammation, and I would say all the diseases.
Thank you. And I have a follow-up question for you. Do decision makers listen to you on air pollution in France or even at Dublin? No. Yeah, what do?
Yes, yes, of course they pay attention, because they well, we have to talk with the association of the patients and the association of specific disease patients. So it's a transversal and large panel of interlocutors, and so our leaders have to speak to these potential voters, these associations of patients. I think it is really important to have to talk to them, to explain to them this air pollution has an influence on their life.
Okay, thank you very much. And yeah, we have a question. Which research? This question I think is for the researchers, but also maybe for the European Commission. Which research hypothesis would the panelists suggest as a priority for a new pan-European study to fill knowledge gaps in air pollution and health? Dan, you have a suggestion, or Dr. Annette? Sorry, Dr. Annette, you have a...
Yes,
please,
so in terms of research, one of the things which were mentioned is the convergence of mechanisms on immunological pathways, and also what Dr. Nanpanti has described for asthma. So we have these interactions, and now we have new tools and now new understanding, and to focus there and look at multiple diseases. And then I think another important issue is the research over the life course, as we are now anticipating that there are indeed these effects already in utero with late life complications. And so I think this is an area where we need additional efforts and cohort studies to tackle this.
Thank you. Do we have any other comment from someone else, from other panelists? We have a question, and I think that, yeah, it was addressed to Dr. Annette, but I think Dr. Nian can also answer. Can you say something about the relationship between long COVID-19 and air pollution? Dr. Nian, maybe if you want to start, or Dr. Peters, as you, Dr. Annette, sorry, if you want to start, I don't know.
Oh, yes. This is a very good question, because we are really concerned by the prevalence of the long COVID symptoms. I will speak about the children, because we have more and more data about them. I'm a pediatrician, so I'm really concerned about that. And the symptoms are very considerably between studies. We don't know yet if it's between 5 or 65%. It really depends on the studies. So, but we have a lot of symptoms, neurological symptoms, headache, fatigue, and concentration difficulties, and different pains, abdominal pains, myalgia, arthralgia, respiratory signs, runny nose, cough, and chest pain, and so on, and also disturbed smell or anosmia. A lot of immunological disturbance, and we don't know yet if it's linked to the pollution. It may be if the subject are still in these cofactor of pollution. So it could be a cofactor, and we have to be really cautious and follow this population. And I'm a bit concerned by this long COVID among the children and among the adults as well.
Thank you very much. And I have a question. I think this is more a question for the Commission or our friends for the civil society representatives about the ways of addressing indoor air pollution and why the almost exclusive focus on road traffic when much evidence suggests that fine particulate matters, the primary impactor on health, disproportionately originates from residential home heating, biomass, for instance, and where the population spends much of its time, including vulnerable and young people. So what can we do to tackle indoor air pollution? Maybe we can start with the European Commission, Vincente.
Yeah, well,
and then yes, Thomas and Hugo.
Indoor air pollution it has to be dealt with in a very different way than we presently deal with outdoor air pollution. From the point of view of regulation, they're two completely different animals. So it's indoor air pollution in particular is a field that has not been very active in the past, but it's gathering more and more attention and momentum. We're at such a stage that the focus now has to be on research, I think, and it's that's how we're covering it at the moment. In the Zero Pollution Action Plan, there is a specific mention to indoor air pollution, which is is a good thing. It's relatively novel because it had been relatively abandoned for a while. And here we state that we're going to promote research to look at determinants of indoor air pollution, because as the person who formulated the question was hinting at, there are different, it's a very different set of pollutants that we need to look at in an indoor and an outdoor environment. And in an indoor environment, there's many more possible pollutants, interactions between them. So it becomes very, very complex. So, and the logic of monitoring in representative points and having a monitoring network is difficult to extend to the indoor environment because of the myriad of indoor environments that do exist. So we're going to have to take a look at that with research. I didn't fully understand the point about ultrafine particles and traffic, but what I have to say is that from the point of view of ambient air pollution, the legislation itself, the ambient air quality legislation, does not discriminate between sources. It just looks at the concentrations measured at the monitoring points. It doesn't prejudge whether they're coming from traffic, from household wood burning, or from whatever source. The limits apply regardless of source. But then, it's up to, if there's a situation of exceedance, it's up to the member states via principle of subsidiarity, because they know better to design the measures that target the sources that are giving rise to these exceedances. But as far as the ambient air quality legislation at the EU level is concerned, we do not look at the sources differently, and we do not tell member states which measures they have to take.
Thank you very much. But you said the word subsidiarity, so I think that Thomas can maybe say something on cities and. Thank you.
Yeah, just also to touch upon what Vicente commented on in his intervention, and the sources of air pollution. Of course, well, cities try to look at all the different sources, but it's true that sometimes they have also more leverage on road traffic, for instance, than on the type of heating that is used by by individuals, meaning, well, if for instance that there a short-term pollution episode, of course it's easier to ask people not to take their cars, or to limit to ban certain categories of vehicles on the road, so that you can address in the short term air pollution episodes in the city. On this subsidiarity angle, well, of course, yes, it's up to it's in the directive. It's up to the member states also to determine which authorities are in charge of monitoring or in taking measures to address air pollution. But of course, there are also certain aspects that should be looked at, like what should be the approach in the legislation. I mean, should we only address the national level all the time? For instance, there is a national exposure reduction target in the directive. Should we only look at the national? Does it make sense to look always at the national level? Should we go down to the regional level, for instance? Because sometimes it's, well, a problem that is of air pollution that happens in the city is shared by all the cities in the region. I'm thinking, for instance, of the Po Valley, which is this region in northern Italy where there's systematic exceedance of air pollution, well, of EU air pollution levels in various cities. We also should take into account the specificities of these regions, because of course they don't face the same issues as, for instance, in Northern Europe, where the wind blows much more than in these parts of Italy. So this is also a stake of the future EU framework. How do we achieve the close alignment or a full alignment, depending on the ambition of the European Commission, with the WHO guidelines, taking into account that the situation is completely different from one city to another, from one region to another. If you look at southern Poland, for instance, well, the situation is again totally different, and here we are facing also the consequences of choices that are out of the hand of European cities. I'm thinking about the choice in terms of energy mix, in terms of types of heating again, and on everything also that depends on the EU framework.
Thank you very much, Thomas. Maybe, Ugo, you can have the closing remarks from the panelists, and then I will close the event. So thank you.
Oh, yeah, well, I think indoor air pollution is a very complex topic, as already mentioned. I think the fact that it happens indoor doesn't mean that there are no ways of regulating and helping to protect health. The focus should be on setting good source regulation. So setting good rules about what products standards are, for instance, on having solvents or chemicals harmful for indoor air pollution. Or if we want to focus on domestic heating, we need better rules on domestic heating and the standards for stoves. At the moment, at European level, it exists eco-design requirements for stoves, which are completely inadequate. I mean, let's be honest, even the latest eco-design standards for stoves lead to PM emissions, which are 100 times higher than an old diesel truck. So, and these eco-design rules are preventing cities and member states in having more ambitious rules, because they are harmonizing the market all across Europe. So we need Europe to show leadership also on these things. And we also know that it's not very different from Dieselgate, which I know that Vicente knows very well for having been working on transport issues. A lot of producers are selling stoves and boilers which do not comply in real world with these very weak requirements. Just to give you an example of what happens in the ground, our colleagues in Poland at the moment are taking legal action because some producers are selling eco coal for domestic heating. in a very nice green wrapping to telling people that burning coal for your domestic heating is ecologic and safe for your health. So there are a lot of things that we can do, but we need ambition at all levels. And just to close on, I think on what Thomas said, it's completely true. Different regions in Europe face different challenges, and it's not the same type of policies that need to be applied. And for instance, for domestic heating, we have big problems for energy poverty. So this is a problem of just transition. There are people who just rely on burning coal or wood, or sometimes also waste, because it's the cheapest way of heating their house. The result is that they're having very bad impacts on their own health and creating also a problem for ambient air pollution in the area. But again, I think that Europe can show leadership on this. If we are a real union, we are going to give help to these regions to transition and to help people to make a solution, make choices about the way that they heat, about the way that they move around, they commute. It shouldn't be people to pay the price of this transition. We need governments to help people and make available financial help to make sure that we don't leave anyone behind in having a better society.
Thank you very much, Ugo, for I really appreciate your point of view. Thank you, and thank you very much. As regards today's event, the presentation and the discussion provide clear conclusions. We could identify some very clear messages, and there is an important role that different stakeholders can and should play in improving air quality. We need policies that are evidence-based. We heard the researchers noting the incomplete reporting and data challenges that they faced in the undertaking their studies, and it highlights the need for more reliable and comparable data. At the local level, cities have been implementing schemes such as low emission zones and others that have been showing results in improving air quality. And health professionals are crucial in addressing the dangers of air pollution, communicating with patients, but also with decision makers and the public. We also saw that the window of opportunity to improve air quality in Europe is now, as the ambient air quality directives are under revision, and we have new scientific data on the impact of air pollution, most notably with the publication of the new WHO air quality guidelines. We are hoping for ambitious legislation to protect the health of people in Europe. And with that, our event has come to an end. I would like to take this opportunity to thank our excellent speakers for their contribution and commitment. And I would also like to thank our EPHA team for the help to organize this event. I would also like to thank our audience. Your sharp questions generated a lively discussion and helped to better understand the topic. And finally, thanks everyone for dedicating your valuable time for attending this event. We hope you consider this time well spent. And as we said earlier, you can follow the future developments related to air pollution on our website, and we'll send you very soon the recording of the event, and we also update the event page. And there are plenty of actions EPHA plans on air pollution and health, so you can follow us on Twitter or on Facebook or LinkedIn. We are looking forward to seeing you all again at one of our EPHA's events, and thank you very much.